Brought to you by
Kachai. You see, any time is tea time. But what tea are you drinking? You need a tea that boosts your immunity to fight flu, that has high level of antioxidants which help you improve your memory and reduce signs of age and extra pounds. That tea is Kayonza tea, no matter how you take it, hot, chilled or iced. Kayonza tea has a unique natural flavor.
Well, now welcome back to this particular segment of GMU Agenda. It is Good Morning Uganda still, and of course I'm here with a couple of people. As I said earlier, we're going to be looking at health in this particular segment. Now, I have some of the experts to speak about kidneys. Not this time around, not speaking about selling kidneys. There are also those allegations that happen around the country. And Ruben, would you sell your kidney?
I'm not broke.
Anyway, I also must say that this segment is sponsored by Kayonza tea, the tea that boosts your immunity, that takes away the anti-aging signs, and also gives you a clear memory. Now, on set, at least I'm joined by Ruben, my usual suspect. At least we've been together since morning. Once again, good morning.
Good morning, Felix.
Now we also have Joseph and Peace. They're from Uganda Kidney Foundation, which as I think that celebrate the World Kidney Day Conference of 2019. You're welcome, Peace.
Thank you very much, Felix.
How are you? Actually, Dr. Peace.
Thank you very much.
Yes. And
Joseph
Mukasa.
Yes.
Yes, you're welcome, Joseph.
Thank you.
How are you guys?
Are we okay?
For me, I smile when somebody mentions peace. You know, peace comes from, I have a history about the names peace.
Okay.
My first cat when I was a young man, when I was
in Midamiliango.
Yeah, because the Sosh, we used to go for Sosh.
Which school was
so
Peace?
Peace was actually at Anabisunsa. She was a Sunsa. And she had Rugezigezi. I don't know whether this one has Rugezigezi, but
we are ready to find out.
And the breakup was because of the Rugezigezi, so I got Aisha.
Very interesting.
Anyway, you're welcome, guys. Now we're speaking about kidneys. This is a subject that is not very common to many Ugandans, and it explains as to why people don't even know what to do to take care of their kidneys. Most of the organs in our bodies we never know. Not until we have experts or guys who have interested time to advocate for all of these things. And I'll start with Dr. Peace right there. Just kindly take us through the organs, that particularly the kidney. Well, I would ask, what is a kidney? But if you could just give a brief insight of what that particular organ is, what it does, and why should we even be discussing it anyway?
So the interesting thing about kidneys is that you don't really know anything about your kidneys until something actually happens to them. And the problem with kidney disease is that it's actually commonly known as the silent killer, because many times people don't know what's happening with their kidneys until it's too late. By the time most patients present to us, they've reached the end stage of their kidney disease. So it's not, most kidney disease are actually not very painful. People want to feel pain before they go to the hospital. And you know the health-seeking behavior for most Ugandans is that we don't usually go to the hospital unless something really bad has happened. And even then, you wait for it to get really worse. If you have a small headache, you'll say, okay, let me wait, take some water. And then after that, you know, by the time you go to hospital, that's almost the same as kidney disease. So essentially, everybody has two kidneys, although you don't really know if you have two kidneys until you actually test. So women are lucky. Yes, women are lucky.
There's a possibility that someone doesn't have two kidneys and you're born like that?
I get very many referrals of people who come and they've just happened, usually women, they've happened to do an ultrasound scan and then they tell them you have one kidney.
So
and you're perfectly fine. It maybe did not mature when you were born. And you're perfectly fine. That's why even when we encourage kidney donation, you donate one of your kidneys and the other one you give to the other person. And one kidney is good enough. One kidney is good enough for you to run your whole body. God just created you with excess in case you would need it. So it's good that...
No, for me, one thing I didn't know until Dr. Peace, I knew that somebody has one kidney. I didn't know that you can come up with one kidney.
I
thought being a pair helps in terms of what is it called in the language?
Function,
Yes.
So
for me, I'm getting it from you that some people are born with one kidney.
Yes,
I didn't know.
It happens congenitally. You can be born and you only have one kidney, and you're perfectly fine, and there's nothing wrong with you, because one kidney is good enough to support one person.
Wow. Now before I come to Joseph right here, I just want to ask, what are the uses of the kidney in the human body?
The kidney
Before we can
does
speak
so
about the
many
problems.
things.
Yes.
The kidney does so many things. So all the food that you eat, all the water that you drink has to go out somewhere. So that's what the kidney does. It gets out all the breakdown products for all the food that you eat, especially the protein. So we have something called urea, and takes out all the excess water that you drink, because all the food that you eat is broken down into water. So whenever you make urine, that's the kidney working. If you're not making urine, your kidney has a problem.
Oh.
Yes.
Does the color matter?
Yes, the color of the urine is actually very important. You see, most people will come and tell me, oh, I have yellow urine, and that is sometimes normal, sometimes it's abnormal, but most times it's normal. It just means that you're not drinking enough water. When you drink a lot of water, your urine becomes very dilute, so it becomes watery. When you drink a lot of water, when you drink very little water, your urine is very yellow. So when you see that you have yellow urine, that means you're drinking enough water. Oh. And that's usually what I tell patients. I tell them, you look at what your urine looks like. If it's if it's more yellow than white, that means you're not drinking enough water. You need to drink more water.
Now, just about drinks, and I'm going to ask Joseph now, as an advocate, about what should people drink? Before we go into now the real problem, because when talking about drinking, sometimes people drink beer and also their urine becomes, is it said white? It doesn't have...
It changes color. Actually, I'm really advising people, if we can embrace the natural things, the natural fruits, if we can embrace the fruits, these things sold in the market, they may look things which we may ignore, but they are very important. Most especially if at all you can look to what our mothers take out there in the villages. They are healthy. You can see they can push their age up to 65, and you ask why. This is the secret. So we people in Kampala, we assume we are modernized, taking things which are processed with a lot of chemicals in them, and hence injuring our kidneys. Remember, kidneys are very, very fragile. They do a lot of work, but they are very fragile.
Okay.
So Felix, before you come in, you say the food we eat in Kampala, there are pizzas, we have pizzas, we have omelette. So maybe for you come from the village, you don't know these things. For us, those town men, would want to enjoy their pizzas, the crushers, the ice cream, the KFC chicken. Yeah. So you think that's so not good for the kidney?
Yeah, most especially we need to take them in reduced amounts. I know modernization is good. It's good to advance, but let me tell you, we need to take them in reduced amounts. As we taking more of,
for example, let us try to be specific, and this is for both any of you. On average, what would someone's eating habit be on? Let's look at a week.
So usually,
to have a good kidney.
Usually, to have good kidney function, one of the things that you really need to avoid is salt. Okay, so salt usually, if you take a lot of salt, increases your blood pressure. And blood pressure can damage the kidneys. So you find that there is this salt that you add into food, and that's what most people actually talk about when they talk about salt. Yeah. Yes, raw salt. But there's other salts which are hidden in food. For example, bread. Bread actually has a lot of salt, and people don't actually realize there's actually a lot of salt in bread. But bread actually has a lot of salt, and if you could cut down on how much bread you eat, that's usually a good thing. Okay. And then also, pizzas, for example, pizzas have a lot of salt because the dough is actually a bread-based dough most of the time. Crushed. If you go to fast food restaurants, I'll not mention any here, but fast food restaurants, all the fast food usually they'll add a lot of salt into it. But also oil, especially animal oil, is not usually good because it builds up in your blood vessels and then it blocks them.
What
and
do
then
you mean
your
by
blood
animal
pressure.
Oil?
Animal fats, products from animal fats.
Okay.
So how about those who
meat,
enjoy pork?
especially meat
How about pork?
and pork.
I told you.
Even if it's dried very well.
Yeah.
So if you're, for example, if you're trying to eat chicken, you try to avoid the skin because the skin has a lot of fat. So if you just eat the meat itself, I know it's the sweetest part. But yeah, but the good protein that you really want is in the white meat. So usually chicken and fish. Those are the good ones.
Oh.
Yeah.
Okay. Now we're looking at the challenge of, first of all, the country presently has only 8 doctors specialized in kidney care and teaching. Let us even start there. You're only 8 people in Uganda who treat kidney sickness and what?
So maybe to begin at the beginning, first of all, how much is the burden of kidney disease?
Exactly.
Like how many patients actually do have kidney disease? One of the founders of the Kidney Foundation. So the Kidney Foundation, essentially, the job of the Kidney Foundation is to increase awareness for patients who have kidney disease, not only amongst the patients, but also amongst the healthcare workers. Because if the healthcare workers are very aware, then that means that they will screen the patients, and therefore more people will be actually captured who have kidney disease. So one of our founders, Dr. Kalisula, did a study, a community study among his patients in the community. So he called people, come, let's screen. And they found that 1 in 5, can you imagine, 1 in 5 people had abnormal kidney function. That means that they did their urine test and it was not normal, or they did a sugar, or they did blood pressure. And they found that there is abnormal kidney function for these patients. It's not that they have kidney disease, but they have abnormal function of the kidney. Okay? So that means that in the 4 of us, if we added 1 person here, 1 of us would have an abnormal kidney function. Yeah?
But tournament don't have kidney problems, I was told.
So that would be Joseph.
My doctor anyway.
That doctor is not very accurate. That doctor is not very accurate.
All that could be peace yourself.
Yes, it could be me. It could be anyone.
I know.
That's the thing. That's why we all need to do screening for kidney disease.
So when somebody is taller than the other, the kidney is also tall?
So the kidney usually is perfectly matched for your size and your height, but especially for your muscle mass. If you have a lot of muscle, you have increased function of the kidney. Because one of the markers that we look for is the breakdown product of muscle. So when you have more muscle, you have increased function of the kidney. So maybe if you're taller and you have more muscle, maybe that could explain.
Now you're trying to talk about the burden of kidney disease in Uganda. And we're looking at now statistics. You're talking about a ratio of 1, at least every out of 5 people. And the challenge is that there's not awareness anyway. People don't know, not until they are called to screen and all these things. Now, the question would be, looking at all this burden, and also the presence of only 8 doctors. In fact, that is shocking.
Yes.
What is being done?
So, first of all, Kidney Foundation is here.
Exactly. To
increase awareness. One of the things that we really take pride in, that we really do, is we organize a World Kidney Day. So every second Thursday of March, the world celebrates Kidney Day. And we really make sure that we maximize and use that day to spread as much as we can awareness on Kidney Day.
Second Thursday of March?
Second Thursday of March.
Every year?
Every year.
Okay.
Yes, every second Thursday of March, which is this week, yes.
Okay.
So during that time, we try to increase awareness, try to increase people's, going to screen, even doctors thinking about it. Because in most cases, if the doctor does not think about it, they will not screen for it. Okay? And then we also try to encourage amongst the medical fraternity, the doctors, try to encourage young doctors to take up kidney disease and to actually specialize in kidney disease. Like you said, there's only about 8 specialists for a population of 40 million.
But where are they?
That means
are they all in Mulago or they're scattered out?
That most of them are actually located in Kampala. That's the problem.
If not all of them.
So outside, actually, all of them. No, we have one outside. We have one in Mbarara. So there's 7 in Uganda, 7 in Kampala, 1 in Mbarara.
So why don't you go to Gulu, you Dr. Peace? Okay, please.
I will probably cross over at that point, but I need to build the capacity here, train more doctors here so that they can spread out to others. Because if I go to Gulu, I can train from there, fine, that is good, I would do that. But most of the training facilities are based here in Kampala.
Oh, yeah.
So I think training at this point is very crucial to increase capacity.
Yes, Joseph.
And on top of that, remember you need expertise in Kampala because of the need.
The referral.
Yeah, the referrals.
Okay.
So that's why she's around.
And now we're looking at, and this will go to you, Joseph, still. Now we're looking at the unbearable costs of the dialysis in the country. And most of the challenges, that most of these sicknesses do affect people who do not have money.
True.
How affordable is the treatment or the services for that matter?
It's really expensive because because basing on this, on the statistics here, they show that a cost of a dialysis it can be.
We're looking at at least 760 to 3.6.
Yeah, to 3.6. But remember, an average Ugandan earning, he could be earning like a maximum of 300 or 400 to 500. The one who has made it. Yeah. Now he can't handle a dialysis. But remember, he's earning it per month. But this is a dialysis per session, 3 in a week. Yeah. So now we're trying to see that if the cost can be cut down. First, by creating awareness, encouraging the policymakers to come and to be part and parcel of this exercise, so that maybe they can fund it and also reduce the cost.
But for me, I would beg to understand, as an ordinary person, what is dialysis?
Very good.
Yes.
Very good question, actually. So, when your kidneys completely fail and you have no more kidney function, there's a machine that we can put you on, connect you to, that helps to take out all the toxins in your body. And this machine is what we call dialysis.
Okay.
So essentially, when you're on the dialysis machine, you're urinating. Because when you're off the dialysis machine, you're passing very little urine or no urine at all to support your kidney function. So the machine, because you cannot be on it all the time, because right now your kidneys are working right now. They're creating urine, the urine is being collected in your bladder, and you'll urinate. So your kidneys are working 24/7. But when you're on the machine, because the resources is very limited, you're only on it for 4 hours in a day, okay? And we only do it, the standard's supposed to be 3 times a week, but the government has helped us and subsidized for us in Chirudu to do 2 times a week at a subsidized cost. So most patients, because of the low cost, do 2 times a week.
Okay.
So imagine, out of all the hours in the week, you only urinate 8 hours, okay? So that is essentially what dialysis is. When you're on the machine, you're doing the kidney function. So most patients have to do it every week, 2 times a week for the rest of their lives, or until they get a kidney transplant.
So that, picking from exactly what you've said and what we've been asked, is that you mean to say that there's no point at which the kidney is okay and it is back to functioning?
That's the thing, yeah, that's the thing, that's what I said. When we begin dialysis, usually, it's either to support kidney function if your problem has just come in acutely, like in a few days, and you have low kidney function and want to support you until your kidney recovers. That's for the minority of our patients. But for the majority of our patients,
They don't recover.
There's no recovery for the
Actually, I was
kidney
about to say
function.
that people who go on dialysis don't recover. They go to, I've had a couple of friends, including so one of our own here, who left us. We went for dialysis for 3 weeks and then he passed on. So you, the doctors who come here and preach the gospel of we can cure you, we dialysis and what. So for us, we want assurance because I would actually choose to die than to spend 10 million when I'm eventually going to die. So what is the assurance that when you go to for dialysis, you can recover? Maybe there's an age bracket where if you are 15 years, you can get back, but if you are 70, you cannot. So give us that age bracket of
and
dialysis.
I think what he's saying is that the circumstances that surround dialysis, that when you're this, you can, when you're this. And
So the thing with dialysis is, and I don't want to say that really if you do dialysis, you're going to die. No.
People have died. 90% have died.
Yes, that happens.
Yes.
They have died. But the reasons why they have died is because they've had multiple complications. Okay? But if you do dialysis properly, okay, like I said, the international standard is 3 times a week. If you do properly 3 times a week, there's people who are even able to go to work come back, do their dialysis sessions, live their normal lives, you know, and they have a good, healthy lifestyle, okay? Just because you're doing dialysis does not mean, and actually this is what we're trying to promote, just because you're doing dialysis does not mean that you're going to die. No, and this gives you an opportunity. It's actually a life-sustaining, like a life-supporting procedure that actually helps you to go on because your kidney function is not good. Okay. And without kidney function, you would not be able to do the things that you're able to do. So dialysis actually gives you an opportunity to be around, do the things that you can be able to do, see your relatives, like, your life has not ended. Okay.
Yeah. So please, can't you give birth as a woman while under dialysis?
We've had, not in Uganda, but during in advanced settings, advanced places, I've seen women who actually do give birth on dialysis.
But you do have now this very nice, beautiful hospital for women. It's called New what?
Yeah,
Matana
the
something.
Specialist Women's Hospital.
Yes, does it do that? Can it do that?
It does not have dialysis yet, but they're planning to put a few dialysis machines in it.
Okay. How about a man? If I'm under dialysis, does the manhood part of the man? Do I function when I'm under dialysis, or I don't?
So the thing with functioning when you're on dialysis usually depends on your mood. You know, it's about your libido. Is about your mood, how you're feeling. You can function if you're feeling well. If you're not feeling well,
produce sperms that are productive, that are fertile.
If you have very good, if you have very good clearance, because it's all about how much toxins, because it removes toxins from your body. So if it removes all the toxins in your body and you're actually good physiologically, your body functions are working well, there's no reason why you should not go on and have other offspring.
No, yes, Joseph. And on top of what you're going to say, I want us to tell us talk about the eating habits. I want to hear that. Yeah. What should people, because from what the look of things and what Peace is saying is that we do not have, I think it's better we speak about prevention now.
True.
Because, yes.
Actually, prevention is key. And the question you've raised about why many of them die, is because they come for these services late. And we need, if at all we can change, you know what we call a mindset. We can change our mindset from seeking services at the later stages, because there is that stage called end-stage renal disease, where a patient is at that level of management of the kidney disease, and he's going through a lot. But currently, if at all we can prevent that kind of situation, seek for services very early. Come, see the doctor, get the medical checkups, those simple tests, the renal function tests, kidney function tests, do these other examinations, the BMI, and many others. It really helps. It helps, and also seek for his knowledge. The fact that we are advocating for more doctors, more specialists in the kidneys and the kidney line, it helps to prevent, it helps to at least get accessibility to the patients so they can have those services with them. They can be aware, they can be informed about why and how they should live that lifestyle. Okay. So on the food stuff, we need to eat. If we can.
I have found people on the streets of Kampala trying to explain on what should be eaten, and they have been talking about sodas, these with acids, these drinks. Basically, and I think start from the drinks.
The drinks, I really discourage processed things. They are not good because of
processed drinks.
Yeah. They are not
so
good.
Most of the processed drinks like
beverages.
These juices, Pepsis, Coca-Cola. If your kidney function is very good, usually it's able to clear out most of these toxins. But if your kidney function becomes weaker and weaker, some of the things that are contained in them may not be very cleared very well. Okay. But also remember that most of them have a lot of sugar, okay? So if you take, say, for example, lots of Coca-Cola, it has a lot of sugar, predisposes you to getting diabetes, and diabetes is one of the biggest causes of kidney disease. Yes.
Yes.
And on top of that, okay, she said the kidney is functioning well, it can excrete all those things. But remember, if it's functioning well, but you continue loading it with a lot of
damaging it.
Chemicals. Okay, it's functioning well, but you're loading it. So I'm requesting if we can reduce. Take a little of that and take more of the natural things, as I told you.
More of the water.
The water.
Does beer affect the kidney?
Beer mainly affects the liver.
Oh.
But also most beers have lots of sugars, which predispose you to diabetes.
Oh.
For me, my issue is you can come here and preach the gospel of the kidney. Well, it is okay. But why don't you preach it to these soft companies, the companies that make soft drinks? That you people, you are injuring.
Have you had interactions with
Yeah,
them?
you talk to them. Because for me, I come from Ikwe. I don't know about your kidney stuff and what. All I know is soda is sweet, fruit is good.
Every
for
function.
me. So why don't you have a mechanism where you go to talk to those companies in Namavi and tell them, you know, guys, people, this is injury, this is a harming, or this is of harm to our people. Why can't you preach the gospel to them? Because for me, I will tell you, as an ordinary person who comes from deep in the village,
Drinking
when
soda is a
Christmas
privilege.
comes around the corner, my mind is on Sprite, Crest, and what? I don't know about kidney failures, what and what.
But that's,
yeah,
but
have
that-
interacted
but that's-
with government
no, but
as
that's,
Uganda
but that's the
Kidney.
thing, like you said, people who say a person who comes from UK and drinks soda once on Christmas Day, that's okay, that's fine.
Okay.
It's quality of life. It makes you happy.
We have
makes you,
people like him who
So-
attend functions
But if,
every
you,
once in
if
a
you're
while.
drinking
Remember.
it every day, that's when that becomes a problem. Yes.
And now, speaking about sugars, how about the sugar that we take?
It's
Kakira,
still, yeah,
what,
it's
Lugasiano.
still sugar, and it's always, I always preach a message of moderation. If you take lots of everything, that is always a problem. But taking a little bit of sugar in moderation, that's okay, that's fine. But also you have to monitor things like, what is your weight? Because sugar makes you put on a lot of weight. If your weight is too much for your body, like if you're obese, obesity, those are the problems that come in, those are problems that you have to avoid. But a person in Buyukwe take soda once in a while,
It's
that
okay.
makes them happy.
And they eat a lot of sugar
You cannot
canes.
deny them that.
And so I'm talking about sugar. For us, when you move around the sugar plantations, you move on and start eating. So is that sugar bad for the body?
That's okay. That's
You
fine.
can have that every day?
Not every day, but you can have that. That's much better sugar than the refined sugar.
And honey, is it?
Honey also has...
Because most of the times people today have substituted sugar with honey. And I don't know how that is.
Because it's a natural sugar, the presumption is that it's a better sugar than a refined sugar.
But there's no difference.
But in moderation, as always, in moderation. If you take too much of it, it still will harm you.
Now, I just want to ask another question. What are some of the diseases that come with, diseases that arise from bad kidney or kidney failure? Are there any other diseases that can be evidenced?
So the very commonest causes of kidney disease are diabetes. If you're diabetic, make sure your doctor has screened you for kidney disease. If you have high blood pressure, make sure your doctor has screened you for kidney disease. And then other very common things is medicine for pain, like diclofenac and aceclofenac. Some of those painkillers are very bad for the kidneys. Paracetamol is more for the liver, not very bad for the kidney, but diclofenac, that's what most people take. And that is really bad for the kidneys.
Especially those who do self-prescription. Pharmacies, many pharmacies.
Most of the ladies who go into their menstruation periods use a lot of these painkillers.
Yeah. Yes.
And that in turn, for example, if they use it, let's say for 3 days every month, how bad is that?
So 3 days every month, as long as the main thing is to make sure you're drinking a lot of water. The main treatment for kidneys is really water. If you're drinking a lot of water and you're well hydrated, it does not cause as much damage as if you're drinking very little water and you're very dehydrated.
Okay.
So for ladies who do it,
warm water?
it's all the same. Whether it's cold, whether it's warm, whatever your preference is, in my opinion, I think it's all the same.
So please, Uganda Kidney Foundation, is it under the Ministry of Health? Or it's a different body?
No, it's an NGO.
It's an NGO.
It's a non-governmental organization.
It's made of, it's an umbrella of doctors, nurses, health workers, and us, advocacy experts, who are looking forward to bridge the gap between health workers and the people, the lay people out there, so that they can at least access the services in one way or the other, including knowledge, because we've been paying a lot of money to go and see her. just to advise you what to take, to advise you that change your lifestyle. But now you're getting it free of charge. So we're looking forward to this kind of initiative, so that at least someone out
So are you
there-
volunteers, or you are here to grab people's money?
No, we are
100% volunteers.
In fact,
People come like you in this umbrella of we are volunteering, yet behind their backs
volunteers.
it is actually grabbing
So now,
sacks of money.
right
Yeah,
now she could have
no.
been seeing someone there. a
Okay.
patient there, but
actually,
yeah.
speaking about the grabbing money of Ruben, I'll talk about the stakeholders in the fight against kidney and its complications. Who are the basic stakeholders we're looking at here?
So the
Who
reason
should be concerned?
the main stakeholder is actually the patient,
Okay.
because it's your kidney and you're the one who's going to be looking around amongst your family members, when problems come. So therefore, you are the primary stakeholder, you as the patient, okay?
Yeah.
Then other stakeholders will include the healthcare workers, because if the healthcare worker is not very cautious of the kidney and does not check, they will not find out, or they will find out when it's too late, okay? Then the next level of stakeholders is the government, which should, we are really trying to advocate for the government to at least increase hemodialysis centers and increase funding for training.
Did you
because
say
if
we have one?
we have only
In
two
Kirundi.
public
Doing
public
dialysis.
centers
Okay.
doing dialysis.
That is
And that is in Chirudu, where we have about 20 machines,
Oh.
and in Mbara, where they have only 3 machines.
and in private hospitals.
And in private hospitals, we have
Case.
still less than 10
Less than Case Hospital,
hospitals in
Nakasero,
Kampala
Norwich,
which
Sanya,
provide.
just a few.
Yeah. And
Only in
outside,
Kampala.
that, patients who are from Karamoja, patients who are from Kotido,
Yeah, I
they
can
have to
imagine.
come
To
all the way
Kampala.
to Kampala. And remember, I told you it's 2 times a week. So that means that you cannot be up and down. So most of them actually have to get accommodation in Kampala. So imagine if you're like a 65-year-old man, you're supposed to be enjoying your retirement, and now you can't even stay on your farm, you can't even be, close to your people because you have to get accommodation and rent
But
here.
remember,
So it's really
as
a
I
problem.
told you, the patient in Karamoja to remember to come for the service of kidney care. He comes at that later stage. So he remembers to come for that service. Remember, it's at a later stage where survival.
When something has manifested as a
Yeah,
sickness
survival
or
is
something.
minimal. So if at all now awareness is now coming in place, so if at all, since they are the next thing, the stakeholders in place, if they can, if we can join hands together, I believe.
Now, let us look at the solutions. Oh, yes, Ruben, before
Yeah,
I come to
actually,
solutions.
you did mention about the elderly. I was actually about to ask you what program you have for the elderly who are in hard-to-reach areas.
Exactly.
I mean, my mother in Ruwero might not be able to travel to Kampala, but the district might have a health facility where you can have a machine put there. So do you have any plans of moving the entire Uganda, getting machines on district levels, on health center 3s, or
That is what we want to do. It costs a lot of money
Yeah,
to
well,
set
actually, I
up.
was going to ask, what is the cost of this, if you may know?
So we have rough estimates of how much it would cost. So to set up a center that has about maybe 4 hemodialysis machines, and those could, because usually they work in shifts. We have a morning shift, mid-morning shift, and evening shift. Those would be 3 patients in a day. So if we're able to set up a 4 hemodialysis center place, it costs about 550 million, which for a government I don't think is a lot of money, considering how many people are traveling back and forth, and also considering how much it costs to send a patient abroad to get a kidney transplant. So if you invested that money in the different, we want to at least have the regional centers, each of them have a dialysis unit,
So that
and
would
patients
mean-
will be able to come from somewhere closer to home to have hemodialysis.
And that is really, really affordable, I must say.
Yeah.
But now looking at, let us look at the solutions. What do we do? And I'll start with Joseph, and then Peace will come in.
What we do, awareness is key.
Okay, which is what you're doing.
Which
already.
we're doing now.
but they're doing it in Kampala here.
But at least on national
national
broadcasting.
TV.
So the world is seeing.
The whole
Yeah.
of Uganda
You
is
see,
seeing.
Ruben
Actually, the whole world
Ruben
is
always
seeing.
wants to advocate for people in Buyikwe. The next thing was,
Because
people in
they might
Buyikwe.
not have power to switch to put on UBC TV.
But you're going there on the weekend.
If I might well talk to all of them.
Anyway,
Yeah.
But maybe what I can mention is that this year we have been privileged to be hosted by the Parliament of Uganda
Okay.
to have us plan our Kidney Day activities at the Parliament. So that means we're advocating to the members of Parliament who will go to their health communities and therefore spread the message. And they will also advocate to government to have more hemodialysis centers set up.
Let's first commend them actually for that opportunity to host us at their premises. Actually, they are coming down
Those
to
are
us.
country premises.
Yeah, they have come down to us to
those
work.
are country premises.
Of
You're
course.
entitled to do
Yeah,
what?
we're entitled, but
It's not a privilege.
Don't come here and praise Munyagwa that they hosted you.
but anyway, what I'm looking forward is that
They did what they should have done.
But we can't. Yeah, we have to commend them.
But you have to commend them for
Yeah.
acknowledging,
Anyway, yeah.
acknowledging that this is a
Acknowledge that.
problem.
Yeah, true. That's true.
So now we're looking also forward to increase screening facilities in Uganda. Now I'm seeing if at all we have 2 screening facilities for killing patients. If at all we have how many districts? We have more.
More than 50. More than 50 districts.
More than 100.
Actually, yeah, more than 100.
Yeah. So if
Some of them are sub-counties, not districts.
remember,
Yes,
know,
they have been. Yes,
if each district has facilities with it has a hospital with facilities in place and some health workers handling kidney patients with all the with everything in place, don't you think the burden of kidney diseases will be reduced to more than 60% now, and also the cost?
Are you going to be carrying out the screening also at Parliament?
Of course.
Yes. Yes.
On 28th.
So the so the World Kidney
That in
Day
itself means
activities.
that you do have machines as the Kidney Foundation.
We have screening tools. It's not dialysis machines, it's screening tools.
Screening.
Yeah, so screening tools is essentially we do a urine test because that the kidney makes
A
urine. So the urine,
urinalysis.
yes, a
Yeah, at least I
urinalysis.
know that one.
So the urine is usually the first sign that maybe there's something wrong with the kidneys. And also the common causes, blood pressure. So we'll do blood pressure. We'll do sugar, blood sugar, because diabetes is also very common.
Yeah.
And then we shall do your obesity. We'll do obesity screening. So that's also.
I think obesity is simply looking at someone. Does it even have any screening? You just look at
Yes.
someone.
No,
one of our
no.
colleagues is not here, but
No.
you look at someone. But anyway,
That would be a good example to be screened.
What we haven't talked about is also change of lifestyle.
yes.
Like we discussed
Among the
before,
solutions,
and
yes.
Yeah, among the solutions. We discussed before that in Kampala, you having the good life. Now, after here, you're going to go in your car, drive back home.
And what is wrong with that?
No, okay. It may not be wrong, but someone in Buyukwe is taking something natural. Afterwards, you go and dig. That's exercise, and he's doing it.
The kidney needs exercise?
Of course.
No,
factually.
there's been actually information now that the chair is almost as bad as the cigarette. You remember how bad the cigarette
what?
was? The chair, this chair
Where
that
you're
you're sitting
sitting?
in. Yes.
Hey.
Because you get up in the morning, you sit in your car, you drive to work. You reach work, you sit in your chair on your computer the whole day.
Then you sit
You
and drive
finish,
back.
you sit back in your car and you drive home.
You're
And
doing
go to
that
bed.
the whole
So,
year.
yeah, and then you go to bed. So the chair is now the new cigarette. So if you can avoid sitting and get up, walk around,
And
be
work
more
while we are
active.
all standing? or-
Yes, they're now
course.
doing standing computers. Haven't you seen them?
I haven't.
Yes.
They actually
There's
with
now
the Uganda Foundation.
standing walking stations nowadays.
Is it what you use at the
Standing
Uganda
walking
Kidney
station.
Foundation? We should visit and find out.
Sit standing computers. I haven't seen them. They are made from where?
The keyboard is high up, so you stand while
Oh.
you work to avoid sitting, because sitting is very bad for your health.
Oh, really?
Yeah,
Yes.
true.
Very
But
bad.
I've seen people who are always moving. They don't use
And they
cars.
also
and they
have-
have problems of the kidney.
In fact,
So
me, Ruben, if you
the
remember,
effect
the
is
day,
reduced
the
compared
day
to
this
someone
gentleman,
sitting.
remember the goalkeeper who died of
Abel
cancer?
Daira.
Yeah, I was so shocked. The man has played soccer for the last 20 years of his life.
Yeah.
And we kept him, and I'm thinking, even former coaches of Express,
Yeah, David Oti.
So
I
you
don't
remember what
think
I talked about? Alice seeking for health services.
no, but the people have been working out,
Yeah,
doing
they've been
exercise.
working, but they have not. Oh, it's good also as you're doing exercise. Go and see her, doctor. What's up? I've
So,
come to
so
check
will
on
you
my-
then say that people should not do exercise at all?
No, not
They
really.
should. They should.
See.
But
So
for me-
you have those rare cases
Yeah,
of people
yeah.
who are out of the normal,
Surely.
but for the majority, surely you should
Exercises
avoid a
are
lifestyle as much as you can.
So let us take some action points as we wind up. Drink a lot of water, at least I remember that.
Yes.
Try to
Yes.
work out as much as possible.
Yeah.
Fourth, avoid
processed stuff.
Processed, that's the
foods,
word, yeah.
yes.
Processed foods like sodas,
Yeah.
tinned what,
Everything.
Breads.
bread.
Yeah.
You said it has a lot of salt, you
Yes,
said.
yes.
But now our parents give bread home to the
Our
kids
children want
every
bread.
day.
Our children are
Honestly, year in, year out, yeah, and bread and milk, you can imagine, bread and milk.
Milk is okay. Milk is okay for a child. A child's
for the
supposed to
adults?
take milk. For adults, in moderation, not too much milk. Yeah.
And coffee?
Coffee is a beverage in moderation. Again.
Oh.
Yeah. So for parents, try to pack more fruits for the children.
Oh, yes.
Bananas,
Apple,
oranges,
pineapple, watermelon.
yeah, more fruits is much better than the processed food. If you pack a piece of bread, also add maybe a banana to give them a
Two
balanced
bananas,
diet.
one piece of bread.
I haven't
Yeah,
heard about my favorite sauce, greens.
They are good.
Greens are
Dodo.
very good for you. Very, very good for
You know
you.
Jobi?
Yes,
Yes.
they are very
About
good. When they are not fried.
Katukuma. You know katukuma?
They are very good.
Okay,
Actually,
now,
that reminds me. Another problem that we have is with herbal medication.
Ah.
Okay, so most of the herbal medication, we don't really know what is in the herbal medication because it's a concoction of different things put
Dr.
together.
Mutula Kungo.
So
Those ones are
most
Wuyiko.
most patients when they begin, and the first sign of kidney disease is patients who are swelling up. So most of the patients, as soon as they begin swelling up, they'll say, "Oh, they've bewitched me,"
Yes.
and then they will go and get herbal medication. So sometimes that concoction may be toxic to the kidney or to the liver and will give you problems. So when you get body swelling, please
It's
make
better
sure
to go and have a check.
But now that
Yes,
also
get a
takes
proper
me to a
checkup done.
question. I'm sorry.
Yes, Ruben.
but
Lastly.
and it's go to peace. My daughter one time came back home from school with a swollen face. And then the fingers also swollen.
Actually.
When they went to the hospital, they say that there's a kidney infection, and actually she was under medication for a week. Yeah. Does it mean that there was a kidney problem? I need to go and check her again? Or it was cleared?
So if indeed, so for children, sometimes they can get infections, say for example a sore throat, and then after a short while, maybe 1-2 weeks, a sore throat progresses into a kidney disease. So if indeed it was a kidney disease, it may or may not have been, I'm not sure, but if indeed it was a kidney disease, it would be prudent for you to check up again on the kidney function. See how the kidney function is doing. Has it gotten better? If it has gotten better, then that's good. But then you need to do regular checkups because the biggest risk factor for chronic kidney disease is getting that one episode of kidney injury. That's not the biggest, one of the risk factors. If you have that one episode, it means that later in life you may get kidney failure.
Okay, now I'm just going to ask one question, then Joseph will come in. Are there people who are born with kidney challenges? You have seen babies who have manifestation of kidney challenges.
Yes. Yes, there's people who are, just like you can be born with a heart disease, you can be born with any other, even the kidney, you can be born with abnormal kidney function.
Okay, yes, Joseph.
So to supplement on this one's concern, do you monitor your urine output? Now, like for example, you've taken like more than 2 liters or 3 liters, but you've not even released anything out of that. That's a concern. 2 days you're not releasing anything. That's a concern. So you need to at least check that. You need to at least check the urine output.
How many times should someone urinate a day, if it matters?
It depends on how much you drink. If you drink a lot, you urinate a lot. If you drink a little, you urinate a little. So usually it depends on how much you drink.
If you drink a lot and not urinating, maybe there's a problem.
Yes,
it's possible.
There's a problem. Yes.
Okay. It could be the causative. It could be the cause to what this concern was. Maybe the urine is not excreted well and it's just being retained in the system.
Okay. Yeah. Now, lastly, about the celebrations that will happen on Thursday.
Yes.
And I'll start with Joseph before I come to peace.
So the celebrations, it's World Kidney Day celebrations, which is done every year, commemorate kidney disease, the fight against kidney diseases, and right now it's going to happen on 28th. 29th and 30th. Why? Since we're in the premises, parliamentary premises, we're going to have the speaker in place.
So it's not next week. It's not this week.
Yeah, it's not this week, but it just came circumstantial.
Yeah, because of the place where you're going to.
All right. So the parliament itself is going to be part of this. On the 28th, we're going to give free screening We're going to give awareness to the public. We're going to have a march from Lago to Parliament when we are advocating for the fight against kidney diseases, using prevention measures, and also creating awareness to see that people out there come out and seek for services as early as possible, so that they don't remember that later stage to come, which take years, so when it's late.
Actually, kidneys in Sigo.
Yes.
Yeah. I've been trying to look for that word in Uganda.
Yeah, in Sigo. So we need to see that at least someone can come.
Can you tell us the name of that in their language also?
She's going to tell us. So we're looking forward to see that someone can come and seek for medical services as early as possible to avoid those concerns you had that a goalkeeper doing exercises is dying of kidney. So,
okay.
Yeah.
Now, lastly, peace to our viewers and people out there about the celebrations and, of course, about kidneys.
So to our viewers, you're very, very welcome to come to the parliamentary grounds. It's open for everyone, for the general public, as well as for the parliamentary staff and members of parliament. You're all very welcome. On the 28th, we're going to have screening. We'll begin with a march, which will begin at about 9 a.m., and then the screening will begin thereafter. So from about 10 till whatever time the crowds get finished, we shall continue with the screening. And then thereafter, I would like to invite as well the general public to, we're going to have conference-like talks provided by specialists in the field of kidney disease. So everybody is welcome to come and listen to everything that they have to say about what's happening with kidney disease, what services are being offered, and what needs to be done. Kidney disease in my language, kidneys in my language are called ensigo. That's
same thing.
Yeah, same thing. Ensigo in Onyankole. Unless there's a different, which I don't know, but we call them ensigo. Usually when I'm talking patients, I call them ensigo.
Ah, okay.
Yes.
Ruben.
But for me, thanks so much for coming.
So we're going to do some exercise also on that day.
Ah, there'll be some workouts.
Some workout.
Okay.
So if you've never done it, come and have a chance and we do it. It's going to be fun.
Okay, now Alista, our viewers have heard. Please take time off. That is on the 28th, you said?
Yes.
And
Yes.
the 29th.
Yes.
Okay, at the Parliament of Uganda.
Yes.
There are 3 days.
Yes.
28th, 29th, and
Yes.
30th.
Yes.
One day screening, free screening, and awareness.
days conference.
2 days conference.
Okay.
So if we screen, if there's, sorry, Felix, if the screening, if you find out that Ruben has a problem with the kidney, can I have free medication?
Then you have a referral for care, and you can have a free consultation.
Okay. Now, thank you so much, Peace and Joseph, and the people at the Uganda Kidney Foundation. Thank you so much for taking off time to create awareness and also to help people with kidney challenges. And of course, we must say also thank you so much, Kayonza Tea, for sponsoring this particular segment. And as I've always said, it does boost your immunity. Now, we have come to the end of our GMU agenda, but we must leave you with some food for thought. I think, as Joseph and Peace have been saying, we must change our eating habits. It's the only way, I think, to prevent this very, very, very unfriendly sickness with the kidneys. Some of these things we never know. Now, we shall leave you with our quote for today, and Ruben is going to come on and give you the sports updates. Good morning.
Was brought to you by
Kachai